Sponsored by the Carpal Rx. If you have carpal tunnel syndrome, more than likely you're going to visit a doctor soon. You probably have your own list of questions to ask your doctor, but there are 10 crucial questions every patient who has carpal tunnel syndrome should ask their doctor to ensure they get proper care and the proper treatment. The first question you should ask is, what is causing your symptoms? Carpal tunnel syndrome is a disease, and there is no cure for the disease. So if your doctor tells you that your condition has come from too much use of your hands, then it's an indication that he doesn't know what carpal tunnel syndrome really is. The next question you should ask your doctor is if he is sure you have carpal tunnel syndrome. This is one of the most misdiagnosed diseases in the world, and often confused with wrist tendonitis. You should also inquire about the severity of your condition. That's because new or recent onset conditions are treated differently than older or chronic conditions. You should know what your treatment plan is. All healthcare professionals recommend that conservative, non-surgical therapies be used first, before surgery is even considered, and these include rest, night splinting, and therapeutic massage. Another question to ask your doctor is if the current treatment plan is going to bring your hands back to normal again, or is it simply going to minimize the pain and other symptoms. You should next ask your doctor what the plan is if you don't see improvement with one treatment plan. Remember that multiple non-surgical conservative therapies will work very well in most people with carpal tunnel syndrome. You should not be shy about asking your doctor about his experience with carpal tunnel syndrome. After all, your life is in his hands. Ask how many surgeries he's performed and what his success rate is. If, after using all non-surgical therapies first and your doctor recommends surgery, which one does he recommend? Open release surgery or endoscopic surgery? Each has its own risks and benefits. You are a unique individual, so ask the doctor what the particular risks and benefits are in your particular case. What are his expectations for you after you have the surgery and further on down the line? Finally, if your doctor does recommend surgery, ask what you can do to improve your chances of recovery so that your carpal tunnel syndrome will never return again. And above all else, make sure your doctor is well informed. Make sure this doctor offers state-of-the-art diagnoses and treatments and discusses all of the dangers of carpal tunnel surgery. Just as importantly, make sure this doctor discusses all non-surgical treatment options with you. Carpal tunnel surgery should be the last thing you discuss with this doctor because he should recommend all non-surgical treatments first. He should inform you that most patients are dissatisfied with their carpal tunnel surgeries. But in actuality, the vast majority of patients are quite satisfied with non-surgical therapies. That statistic is so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all doctors advise their patients to try all non-surgical options first before considering surgery. So what are those non-surgical options? They're actually very simple. They consist of rest, splinting your hand at night, and deep tissue massage therapy. In fact, deep tissue massage therapy is almost 100% effective in relieving carpal tunnel syndrome, but it's only effective if you use it daily and for 2 to 4 weeks. But to get deep tissue massage every day for your carpal tunnel syndrome, you don't have to visit a massage therapist every day. Instead, the Carpal Rx will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal Rx. If the Carpal Rx doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal Rx was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal Rx automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. The Carpal Rx always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal Rx is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal Rx at carpalrx.com.